This recording will go over Chapter 52, Medications Used to Treat Osteoporosis. Osteoporosis is a progressive, debilitating skeletal disease that is the result of a loss of bone mass and severe decline in bone mineral density that affects older men and women, resulting in decreased bone density and possible fracture. Osteoporosis occurs through an imbalance of osteoblasts, bone-building cells, and osteoclasts, cells that break bone down, which causes bone resorption activity to exceed bone-building activity, which leads to decreased bone density. This imbalance creates a porous bone that leads to increased fracture. Bone is a dynamic tissue. It undergoes a continuous process of formation and resorption or destruction. And here you can see a visual of what the bone looks like as it progresses from normal bone density to decreased bone density and severe osteoarthritis. Women older than 50 years are at greatest risk because of the loss of estrogen during menopause is greatly related to the loss of bone mass density. Bone mass is at its highest density at age 30 and then steadily declines. The most serious fracture site is the hip, and a hip fracture is the second most common reason for older women to be placed in nursing homes, exceeded only by Alzheimer's disease. Women who experience hip or vertebral fracture may have long-term, progressive, and debilitating health problems that eventually lead to death. A lot of times if you have a pretty elderly person that comes into the hospital with a hip fracture, it can be the beginning of a downward spiral towards death. A lot of elderly patients have a hard time bouncing back from that hip fracture. And when we talk about hip fractures, what bone is it that we're talking about? Patient, when they say a patient fractured their hip, they're actually talking about a fracture of the femur. Diagnosis of osteopenia and osteoporosis is made using a DEXA scan, DXA. The results of a DEXA scan are translated into T-scores. Normal bone mass density is a T-score of -1 or greater. Osteopenia is defined as a T-score of -1 to -2.5, and osteoporosis is defined by a T-score of -2.5 or less. Hormone therapy is not recommended for the treatment of osteoporosis, but may be considered as a preventative measure in postmenopausal women who are at risk, not first-line therapy. Women who have used hormone therapy for 5 years or more have shown to have a 35% reduction in hip and vertebral fractures. Other drugs can manage osteoporosis and prevent fractures without the concerns raised by hormonal therapy. These include bisphosphonates, which can reduce the breakdown of bone microstructure, and selective estrogen receptor modulators. Prevention of osteoporosis includes sufficient intake of calcium and vitamin D throughout the lifespan by either dietary intake or supplementation. Calcium should be taken in divided doses and with adequate vitamin D to enhance absorption. So it's important that you know the role vitamin D plays in the patient who's taking calcium to prevent osteoporosis. Vitamin D helps the body absorb calcium. All calcium preparations except calcium citrate should be taken with food. Smoking cessation should be encouraged because smoking interferes with vitamin D absorption. Alcohol consumption should be limited to 1 drink per day because alcohol reduces GI absorption of calcium. Weight-bearing exercises such as walking, jogging, low-impact aerobics, weight training, and yoga strengthen the bones, increase muscle strength, and enhance balance. Caution should be used in patients who are prescribed drugs that cause hypotension or dizziness. All patients should be assessed for fall risk, and the prevention of falls should be part of the nurse's healthcare teaching. Advise the patient to report an increased thigh or growing pain, which could be an atypical, rare femur fracture. One classification of medication used to treat osteoporosis is bisphosphonates. Your prototype bisphosphonate that you need to know is a medication that's used to treat osteoporosis is alendronate, brand name is Fosamax. Fosamax is used to prevent and treat osteoporosis. It's available as a daily or weekly dose. Important patient teaching that you must know for the patient who is taking alendronate is that it must be taken with 8 ounces of water 30 minutes before ingesting any other foods, liquids, or medication. And then the patient must be remained seated upright for at least 30 minutes. So this will be a first thing in the morning medication with 8 ounces of water 30 minutes before anything else is taken orally, and the patient has to be seated upright. And the reason for that is that there can be some sort of reflux that can really damage the esophagus. So because of that, again, the patient is upright. Side effects include nausea, abdominal pain, difficulty swallowing, esophageal inflammation, reflux, and ulcers. It's important to teach our patients not to take alendronate with aspirin, NSAIDs, or antacids. There's also injectable bisphosphonates that don't have any GI side effects, and they can be scheduled quarterly or yearly, so that's a nice option that's available. Contraindication for alendronate would be esophageal abnormalities or delayed emptying of the esophagus, inability to sit or stand for 30 minutes after oral ingestion, and hypocalcemia. So again, with this patient, they have to take it on an empty stomach, 8 ounces of water, 30 minutes before they take anything else orally, have to remain seated upright. I've seen nurses who will pass it early in the morning and then let the patient lay back down and finish sleeping, and that's not what we want to do. The patient has to be upright for 30 minutes. So again, your prototype medications you need to know for the treatment of osteoporosis are calcium, vitamin D, why they're taken together, and also the alendronate and the patient teaching that goes along with it. And then I just want you to be able to recognize that another classification of medications used to treat osteoporosis are selective estrogen receptor modulators. And I'm not worried about you knowing or recognizing those specific different names, but I do want you to recognize that classification.